Hi everyone! Welcome to Ako Muna, Ako Mismo, a webinar on prioritizing personal health for better patient care. This intended 30-minute session starts with this presentation followed by Q&A discussion. And this webinar is an initiative of the Institute for Studies on Diabetes Foundation, Inc., Alumni Association, Bulacan Chapter, and the Manuel V. Santos Foundation. The non-communicable diseases are the world's largest killers. Alam natin na palaki ng palaki ang problema tungkol dito. At dito sa atin sa Pilipinas, alam ba ninyo, the top 4, ischemic heart diseases, cancer, cardiovascular diseases, diabetes mellitus. Sa kanilang apat pa lang, almost 50% na ang maa-account ng total ng top 10 leading causes of mortality in the Philippines. Most, if not all, clinical practice guidelines of the various medical specialty societies indicate lifestyle modification as foundation of care. In the CPGs, they indicate lifestyle modification as initial intervention or in conjunction with pharmacotherapy or together with active care. So it is really important that we incorporate lifestyle intervention as part of disease management. In your clinical practice, are you able to advise or prescribe or at least refer your patients for lifestyle interventions? And how do you go about it? Or may team kayo sa clinic na nag-educate sa mga pasyente at nag-interview sa kanila? Is time constraint a barrier for you to do this? Matagal talaga no, mag-interview ng pasyente, lalo na kung may kasama itong coaching. Aalamin talaga yung personal information ng mga pasyente. In this article, the author emphasizes the critical role that physicians play as health models for their patients. Ang laki ng expectation, ang taas ng expectation. Kasi nga, malakas ang impluwensya ng mga doktor sa mga pasyente. The author also reiterates that it's not just the patients or the family members of the patients, but the general public as well. Everyone looks up to the doctors as the epitome of health. And I quote, "Physicians can provide motivation for people to achieve their health goals. Healthy physicians can help people become healthier." Pero may kasunod na comment. It's interesting whether you can give someone advice if you do not follow it. Pressure. Pero may point sila, di ba? Tama naman din. As doctors, hindi tayo confident na magbigay ng advice or health advice kung sumasalungat din naman sa condition natin or sa paniniwala natin or sa habits natin. The article also mentions the Medscape Physician Lifestyle and Happiness Report in 2018, showing that 47% of physicians were trying to lose weight, and that of those participants, only 10% exercise daily. 23% of them were exercising 4 to 5 times weekly, and that nearly one-third of the physicians, or 32%, reported either not exercising at all or only exercising once per week. Kayo po ba? Tayo po ba dito sa Zoom room? Nakakapag-exercise pa ba tayo ng 30 minutes a day, 5 times a week? I'd like to show you another paper. This time, tinitingnan dito yung well-being and lifestyle habits of primary healthcare physicians in Bahrain. Sa survey, tinanong sila, ilang oras kayo natutulog sa gabi? Gaano kadalas kayo kumain ng restaurant food or fast food or processed food? Nakakapag-exercise pa ba? Dito, nag-survey sila sa 152 male and female primary care physicians with a mean age of 45. At the end of the survey, ito yung nakita nila. There was a clear pattern of unfavorable lifestyle habits and high prevalence of hyperlipidemia, hypertension, and obesity among the participants. In conclusion, the authors encouraged institutions, and I quote, to further enlighten physicians on the importance of living healthy lifestyles. May pabaon. May paalala para sa lahat na makakabasa ng kanilang paper. So, how are we? How are we doing? How are you? As doctors, we take care of other people's health, but who takes care of us? Sure, we have family members concerned for us, but who takes care of our health? Alam na natin ito. Wala namang iba. Tayo-tayo pa din talaga. Easier said than done. So we might as well check in on each other. So, kumusta yung gising mo kaninang umaga? Nakatulog ka ba ng maayos kagabi? Anong oras ka ba usually natutulog sa gabi? And anong oras nagigising? Did you wake up feeling refreshed? O pagod pa rin pagkagising? Ironic na nung med students pa tayo, patagalan sa puyatan. Now we know better. Now we know that lack of sleep can lead to irritability, poor judgment, delayed reaction, and can even cause accidents. And we now know that it's really important to sleep for 8 hours to maintain health, and that chronic sleep deprivation can lead to non-communicable diseases such as diabetes, hypertension, obesity, even cancer. Tinuturo natin ito sa mga pasyente natin, di ba? Pero yun nga, madaling sabihin, mahirap gawin. Lalo na kung may magandang K-drama o kung nakasanayan na magkakape sa hapon o sa gabi. O kaya, baka hindi na naaarawan kasi hindi na lumalabas ng bahay. Kaya yun, hindi maayos ang tulog. Baka garahe to garahe yung routine natin from bahay to clinic or hospital and back. O kaya, nakipag-inuman pa. Nag-red wine, nag-beer, nag-inom ng alak bago natulog. Kasi di ba ang alak nakaka-disrupt ng tulog. Ganun din sa nicotine. Pwedeng makadelay ng antok kasi ang tabako, ang nicotine, stimulant siya. Dami naman bawal. Idagdag pa natin dito yung paalala ni American Heart Association. Dati, di ba, meron pang minimal amount of alcohol intake na medyo acceptable na pwede pa. So, isang bote ng beer in a day, isang shot ng hard liquor, isang serving ng red wine, acceptable pa. Pero recently, anong sabi ni American Heart Association? There's no amount of alcohol that is safe for us, for the heart. So there. Kaya, hindi na pala pwedeng mag-inom-inom lang basta. If you want to be healthy, iiwas talaga na sa alak. Kung diabetiko ka pa, tataas syempre yung sugar kasi alcohol is sugar when metabolized in the body. Tapos, uric acid, tataas din. Bakit? Alcohol prevents the elimination of uric acid from the body. Dami naman problema. Punta naman tayo sa positive social connections. May time pa ba makipag-bonding sa mga kaibigan lately, sa kapamilya? Nakakalabas pa kayo? Happy-happy together? Baka sobrang busy na sa trabaho na na-isolate ka na. Remember, we are social creatures and that we need to have positive social connections to keep us sane. Yung mga negative people, medyo iwas-iwas tayo doon sa kanila kasi hindi makakatulong sa atin. Ito pa, kung dadagdag pa sa stress natin yung mga coworkers. Okay, so we really need to do some stress management. Normal na to sa atin, di ba? Yung palaging may stress. Pero sabi nga, kailangan daw may stress management pa rin tayong gagawin. So, how are you able to manage your daily stresses? Nagdi-deep breathing exercises ba? Yoga, meditation, running? Alin dito yung ginagawa mo para ma-dispel yung negative feeling? I hope hindi yan, hindi binge eating. Pero, alam nyo, may time guilty ako sa ganyan. Comfort food. Tapos sa hating gabi, di ba, pag nag-crave, hahanapin mo ba yung, ah, parang gusto kong kumain ng broccoli or parang gusto kong kumain ng carrots. Hindi, di ba? Maalat, matamis, ma-oily ang hinahanap natin. Chichirya usually. So kapag nag-a-attend tayo ng mga RTDs, ganito ba yung hinahain sa atin or ganito ba yung nakakain natin? How many times do we attend RTDs? Healthy eating sana, no? Katulad nun. Pero ito, baka ito palagi. Processed food, fast food, unhealthy eating behaviors. Yan yung baka mas madalas na meron tayo. And nano-normalize na rin kasi. Kaya kawawa din yung mga bata. And yan nga, pag nag-RTD, anong ino-order natin na beverage? O water na lang ba yung preferred ninyo? O kaya tea without added syrup or salt? Baka hindi. Tapos ito, palagi bang nakakapag-exercise? Diba? Yung sabi nga, yung recommendation, 30 minutes of moderate physical activity at least 5 times a week. Iba pa yung stretching, iba pa yung weight-bearing exercises. So we just walked through the what we call as pillars of lifestyle medicine. Healthy eating, physical activity, stress management, positive social connections, sleep, and avoidance of risky substances. Sa mga ito, alin yung tingin nyo kailangan ninyo na ma-improve sa sarili ninyo? Meron ba? Ako personally, yung tulog, kailangan ko pang mas ayusin. Hindi ko pa na-achieve yung 8 hours of sleep na dapat meron tayo. There will always be something in our health that we need to work on. Importante, ma-recognize natin ito at actionan na natin. Sabi nga, with great power comes great responsibility. Naalala niyo po ito? This is from the movie Spider-Man. And so as we see patients day in, day out, we realize that doctors do have the quote-unquote the power to influence patients and the power to directly affect the health outcomes of others. Sa pag-discuss natin sa kanila, dito na po papasok yung malaking opportunity na banggitin sa kanila yung benefits ng lifestyle intervention. Encouraging positive lifestyle changes, providing awareness and education can be beneficial to our patients. It should also be emphasized that lifestyle intervention should be personalized as patients have different characteristics, different lifestyle habits, different reactions to medications, different family dynamics, and different support systems. Kaya lahat po yan kailangan i-consider sa pag-craft ng lifestyle intervention nila. Final word, let's encourage everyone to experience the benefits of positive lifestyle changes using the 6 pillars of lifestyle medicine as guide. Una muna sa atin, i-apply muna natin sa ating sarili so that eventually, hopefully, this translates to us confidently advising, prescribing these lifestyle interventions for disease prevention and active care. So, tayo muna, tayo mismo. Maraming salamat po.